extend a warm welcome to all of you in joining this innovative online learning platform. I am Dr. Annu, a neurophysiotherapist, and I am practicing in Chandigarh in ANH Physiotherapy Clinic. Today I am going to talk about stroke rehabilitation, neuroplasticity and neurolinguistic programming, the role of NLP in stroke rehabilitation. Stroke is a leading cause of disability and death in India. According to National Stroke Association, around 10% of people make it to complete recovery after stroke. Around 25% mild to moderate recovery, and more than 40% of people have moderate to severe impairments post-stroke. The role of physiotherapist in stroke rehabilitation starts from the very beginning. Once the patient is stabilized in the ICU and his vitals are stable, the role of physiotherapy begins right there. Before we start, I would like to give you an outline of today's lecture. We will cover 3-4 topics. The first one will be stroke rehabilitation. What exactly are the impairments after stroke? What would be the time frame for recovery? What are the prognostic factors? And once the rehabilitation process starts, which therapies should be used in collaboration by the patient, therapist and the caregiver so that the recovery can be fastened. We can minimize the time to recover and we can bring the patient back into the normal routine, into the productive life that he was in before the injury, before the stroke episode. So let's first begin with impairments of stroke. Stroke impairments are majorly motor impairments, sensory impairments, cognitive impairments where the patient is unable to determine the orientation, place, person, and maybe reasoning is also absent, abstract thinking is affected, these kind of functions. Then there could be visual, hearing and language impairments when the patient is unable to maybe see because of any optical hemisphere or optical nerve involvement, or there is any hearing impairment, or there could be any language impairment. There could be Broca's aphasia, Wernicke's aphasia, or even global aphasia. Then there could be balance impairment because the patient's orientation is disturbed, the balance pathways are affected in any way, or the patient's coordination is impaired. Hemispatial neglect, that is neglect of one side of the hemisphere where the patient is not able to appreciate that side of the body, because of which his posture disturbance happens and he is unable to do any activity on that particular side of the body because he is not maybe seeing on that side due to homonymous hemianopia, or he is not able to appreciate the position of the body and the existence of the affected side of the body. Now let's talk about the recovery of stroke patients. It was said that initial 6 months play a very crucial role in recovery of the hemiplegic patient. But now the notion is changing. We believe that owing to the neuroplasticity factor, recovery can happen in each and every patient of hemiplegia or stroke because the brain has the ability to restructure itself depending on the correct rehabilitation, intensity, frequency and the right approach, which will decide the outcome, a better outcome. Let's talk about the recovery factors. What determines the recovery post-stroke? One of the major factors is age. If a patient's age is above 70 or 75 years, the chances of recovery are rather poor because the patient has the initial scoring on functional index measure, that is the FIM, activity of daily living score, at the time of the admission also determines the prognosis of the patient. So you can definitely tell between two patients who is going to recover faster. If the FIM score is better, chances of recovery are also better. You can calculate the Barthel index score also, that will also indicate that the prognosis in the same way as FIM. Then urinary continence is another major factor which determines the prognosis. If a patient is urinary and bladder continent at the time of admission, in the beginning, there are better chances of his recovery in the later stages. Of course, cognitive impairment is also a crucial factor. If a patient has cognitive functions intact, if a patient has frontal cortex is not involved, chances of recovery are good, because patient will be able to take the commands during the rehabilitation process. That is one of the major factors, and because of that, the recovery and the rehabilitation process. Now, when we talk about stroke rehabilitation, we cannot proceed further without discussing neuroplasticity first. Now, what is neuroplasticity? Neuroplasticity is the capability of brain to reorganize by forming new neural connections throughout the life. That's why when the change in the environment of the brain happens due to hemiplegia or stroke or any of the brain injury, the neuroplasticity is that core principle on which we can base our neurorehabilitation process and bring out the recovery of the brain. Because the brain is already having an inbuilt mechanism to recover itself. By just leveraging its principles, we can make that process happen faster. That is the secret to a successful neurorehabilitation program. Now let's discuss about the basic principles of neuroplasticity. The first principle is that body parts compete for the brain representation. More any body part will be used, the bigger will be its representation size in the brain. The opposite also stands true. If a particular part is not used, it happens as learned non-use. So the representation of that segment in the brain reduces. That is what happens when the patient is not using the affected side, and later on in the chronic stages, that particular segment becomes kind of lost from the brain's map, and the patient ends up with having no function on that side. By using a novel approach of CIMT, which was given around 20-30 years back by Dr. Edward Taub, this concept was initiated of learned non-use, that if we constrain the normal side and allow the patient to not use the normal side to compensate for the functions, we are basically forcing him to use his affected side. And by forcing him to use his affected side, we are making sure that the brain is increasing the representation of cortical maps of that affected side of the body. Higher neural activation leading to a better recovery. Second principle states that same and contralateral hemisphere can contribute to motor control. That means that if one hemisphere is damaged, the intact hemisphere may take over to some of its functions. To recover, neurons need to be stimulated through activity. The same principle is used in mirror therapy. So when we place a mirror in between the patient's affected side and the non-affected side, and we ask the patient to move the normal side, and we ask the patient to look in the mirror, it is basically tricking the brain into thinking that his affected side is also moving similarly, because the patient is seeing his image and is believing that it is the opposite side of the body, that is the affected side of the body, which is also moving normally. So by sending that stimulus to the brain, we are kind of activating the neurons on that side, improving the plasticity chances, and hence the recovery. It is a kind of visual feedback the patient is given, so that the patient is made to believe that his affected side has a equal representation in the brain, and the brain is sending the impulses on the affected side to initiate that action which he is already seeing happening in the mirror. It is a form of sensory motor learning, and in various functional MRI studies, it is seen that the brain areas that are involved in these type of learning, they are activated by the visual illusion in the form of mirror therapy. We will discuss one more approach today, that is neurolinguistic programming. As the name suggests, neurolinguistic programming, this approach talks about communicating with the brain. It is basically a language of brain, that is to understand how the brain functions and how we can use certain set of commands to elicit a proper response from the brain. to improve the functional outcome, the motor outcome of the patient. Now,
NLP is basically a communication of brain in which we use certain factors like how we think, what are the verbal and non-verbal communications used, and how we can use such communication to change the patterns and behaviors
if
of
a
a
therapist who is
patient.
treating a hemiplegic patient is aware about the concept of NLP, the concept that whatever command you're going to give to your patient has an impact on the recovery of that patient, the therapist is more likely to get out a better response from the patient. And using NLP can actually fasten the recovery of the patient. The best part about NLP is that it can be used to treat even the chronic cases. Now you must have heard, there are cases which are 10 years old, 12 years old, more than that also, who had an onset of hemiplegia, of stroke, and they had taken their share of physiotherapy and rehabilitation for good 6 months, 8 months, and then they dropped out. And from that point onwards, they have certain impairments which they have now become very, very friendly with. They have accepted it as a part of their routine, as a part of their body. If they're unable to lift the arm, they have just accepted it that way. We see such patients in our OPD setups all the time. You will get to see them. Now, what if I tell you that even in such chronic cases, your approach, your rehabilitative approach can bring results? It is a major breakthrough. And I'm not only saying to specifically use only NLP. Our treatment rehabilitation approach has to include all the approaches I've just discussed. We have to make the rehabilitative plan, including all the approaches, be it CIMT, mirror therapy, FES, or even the MRP and other stuff. But while giving the commands and coming up with the exercise plan, practically making out exercise plan for the patient, just a single concept of NLP can benefit the patient to decrease the recovery time, to make them recover faster, be it in an acute stage or in a chronic stage. Now I will come about the concepts and the principles of neurolinguistic programming, how it works, and what is the concept behind it. Now we believe that for every single movement, our brain has a set of certain neuronal circuits, and these neuronal circuits coexist in multiple variations of spatiotemporal changes. And for example, if I have I know a single movement in which I'm lifting my mobile phone and hearing it. Now this single movement of picking up any object and placing it to my ear, this object has multiple memory patterns stored in my cortex. Maybe I have lifted the phone sometimes to answer a client, sometimes to answer to my parents, sometimes I have used that particular action in an angry mood, sometimes in a happy mood, sometimes maybe my mobile phone was feeling hot, sometimes it was in my pocket and I took it out. Different variations could exist for that single action of using your mobile, putting it to answer a call or to do any activity. Now similarly, for example, if we take a simple example of pouring water in the glass, now the same variation in which the action is to pour something into the glass, for the same action, brain has multiple pathways, multiple neuronal circuits in which different memories are stored for that particular motor function, that particular action. Maybe I have poured lassi from a jug in a glass sometime. Maybe I have poured water from a glass bottle which was completely full, heavy. Or maybe I have sometimes used is there to just empty it thoroughly. So the extension, the pronation movement was extra because the water was less in that jar. So variations could be of the angle, of the weight, of the sensory feedback, of the texture of the object, and also with different emotions at different times. One time I'm very happy doing it, one times I'm ignorant doing it, one times it is an occasion of celebration, at times it is an occasion of sad mood, at times I might be thirsty while doing it. So one action is linked with multiple experiences. This is the core of NLP, that For every single action, every single movement that you want to elicit in a hemiplegic patient, there exists a memory pattern, there exists a memory map inside our brain. Now what we have to do is, we have to elicit that particular map, and by eliciting and constantly sending the neuronal signals to that particular memory map, we can elicit the motor output which is needed to perform that action. It is a very simple concept. Understand it thoroughly. There are only two factors which we need to concentrate while starting with this approach in a patient. The first approach is the first thing to understand is the command you will give to a patient, because it is a linguistic based approach. Whatever language we use, whatever command we give to the patient, that has a lot of impact in making it a successful therapy. Now, command has to be very, very affirmative and positive. For example, a therapist has to establish a proper rapport. Now, I know out of today's knowledge or out of my understanding, somewhere I read, using a proper language can impact the patient's outcome. So now I know about this concept and I am using it while exercising with my patient. Before today, I was unaware about it. So maybe my mood, my commands, the way I was handling the patient was having a particular impact on the patient. But if I'm consciously using my commands to alter those signals now, I become more effective. Now, for example, earlier I was giving a command to the patient, hold the glass of water, और इस repetition को 10 times करिए, लेके जाइए वहाँ पे, ऐसे करिए. These are the instructions I used to give, for example, before I knew about the NLP concept. After I know about the concept, I am aware that my command holds an importance. My command has to be affirmative. And the second concept is that my command has to be such which has been a memory map of the patient. The action I want to elicit is already stored in a patient's brain memory. Something which he had been doing before the stroke multiple times. He had been doing it repeatedly. So if I give a command to the patient to perform a function which he had been doing earlier, and doing that function will give me that particular movement which I want to elicit, then I'm successful. Now understand it with an example. I want the movement of patient's flexion, and his hand above his head. I want this movement. Now earlier I was telling him, okay, lift your arm, take it up, bring it down. Lift your arm, हाथ ऊपर लेके जाइए, शाबाश, खुद से जोर लगाइए. This is what he used to say for making the patient do it actively or to involve the patient. Now, after knowing NLP, my approach would be, I will not just ask the patient to raise your arm. The patient has no memory pattern. Nobody has given him a command earlier, raise your arm. Or maybe he was doing it, but this raise your arm command is not eliciting anything in terms of the memory map if I'm talking about. Now, if I give him a command, okay, can you comb your hair? Okay, pretend as if you're applying oil to your hair. Now the patient, if you have to apply oil to your hair, or if you have to comb your hair, can you feel your hair? Are they silky? Are they, what texture are they? Now, listen, if I'm giving a command to the patient, pretend as if you're applying oil to your hair. Now he'll take his hand to his head and he will try to move the hand. Now, after knowing the NLP, my command is touch your hair. Feel your hair. Now he has touched his hair earlier also and he knows how to touch his hair. Now he's bringing the hand up to feel his hair, to touch his hair. He is not raising the arm. He is touching his hair. Touching his hair has an impact in his memory pattern. He has been doing this action. He has been combing his hair. Now once he has touched it, add the second input. Feel the texture of your hair. Now you can do a variation to the exercise. Pretend as if you are applying oil to the head so the patient is moving. The patient will not be able to do maybe functionally the complete action. Therapist has to assist him. But while we are assisting the patient in doing this activity, the patient is actually firing those memory maps inside his brain, and we are eliciting the neuronal circuitry. We are trying to get the response from this particular concept that this action has been repeated multiple times in the past. So no matter what is the injury, no matter how much of damage has done because of ischemic hemorrhage or ischemia or hemorrhage in the brain, there are some circuits which are still existing. There are some collateral connections because of the various spatiotemporal movements he had learned in the past. They are existing in the cortex, they are existing in the head. So if we are doing this movement, those particular neuronal circuits are being stimulated, they are being called to activation, and they will give a parallel stimulation to the motor muscles. So here we are not using the periphery to elicit a cortical signal. Here we are using the reverse pattern. We are eliciting the cortical signals to elicit a peripheral movement. पहले हम क्या करते थे? Earlier what we used to do? We used to move the hand to stimulate the brain. Now we are stimulating the brain by just eliciting diving into the memory patterns, and using those memory patterns we are trying to elicit the action which we are doing. Now maybe I am repeating this action 20 times, I am repeating it consecutively in every session, and then slowly and slowly the patient becomes familiar with this action. The patient relearns the same action. It is easy for him. It is faster learning for him because he is learning, and we are using a component of learning which was already existing in his mind. We are tapping into that potential. We are using those memory stores of the brain to bring out that motor output to us. That is the concept of NLP. That is why it helps you recover your patients faster. Always use your commands for every exercise in such a way that it elicits the function which the patient has been doing earlier and earlier. Now, for example, if a patient has been driving scooter, so to elicit the wrist extension, I can give a command. For example, pretend you're giving a race to your scooter, you're accelerating your scooter. So, this is how you accelerate the scooter, and this is the action the person will do. The therapist can assist the patient while doing it. But when the patient is imagining that he's accelerating the scooter, actually the same movement is happening which I'm desiring in the patient. And the patient, when thinking about it, will take out his memory patterns, and the same motor output will be generated in the body in subsequent sections. There is one more thing which we talk about in NLP is anchoring. We know that the patient has emotional anchors to certain behaviors. While assessing the patient before starting a rehabilitation, we all do assessment. So while assessing the patient, try to find out which actions or which outcomes are more important to the patient. We want to achieve a function, fine, but what is patient expecting from us? What is the function which patient wants to recover fastest? So if we fix a goal on that, we will be able to achieve those goals faster, because the patient's participation to achieve that goal will be higher, which he wants to achieve, as compared to trying to participate in a goal which the therapist sets for him without consulting him or without taking his desires into action. Now, for example, there could be deviations in the desires of a therapist and a patient. How? A patient may feel that I want to, just stand up and go to the washroom independently. And for a therapist, maybe, trying to introduce his grip is more important. The therapist is maybe functioning on or focusing on making him independent in using the spoon, or maybe, making him independent in having food or drinking water. But for patient, the prime goal which he wants to achieve is to be independent in standing and going to the washroom by himself. So always make sure that while you are making goals, your expectations and the patient's expectations are in sync with each other.